Panelist member, or panelist, Melanie Sizemore, the health officer, Elkhart County Health Department. Randal, Christophel, President and Chief Executive Officer of Goshen Health. Kimberly Reeves, Executive Director of Beacon Community Impact. Dr. Kimberly Boynton, Director of Building Strong Brains Coalition. James Ballard, Behavioral Health Response Coordinator of Goshen Mobile Integrated Health Unit. And Brandie Yoder, Chief Executive Officer of RETA. And Liliana Quintero, Executive Director of NIHHC.
Okay, good afternoon, everybody, and happy lunch. I apologize if I still have spinach in my teeth. Took a bite right before I came up here. Okay, I would like to start off this panel. And first of all, I just want to thank everybody for being here. I was just talking to our researchers here about how this is how we improve health outcomes and help the future of Indiana in the space of health is by bringing people from all the different sectors, including our community members, together. And so I'm so excited that we have this group of individuals up here. And with that, I'd like for you all to introduce yourself so people can connect the face with the name after that introduction, what organization you are with, and how your organization, your role is specifically, what is your connection to improving infant mortality? What do you see as your role in that? So Melanie, I'm going to put you first.
Okay. Okay. I am Melanie Sizemore. I am the Elkhart County Health Department's health officer. And my connection to infant mortality is really through our maternal child health programs. That's originally where I started 10 years ago or so. And my passion for many years has been working with moms and babies and improving the health and lives of them. So infant mortality was an easy connection for me.
I'm Randy Christophel, President and CEO of Goshen Health. Our mission starts out with the phrase, we're here to improve the health of our communities. And so that takes many facets and forms in terms of access, types of services, abilities, and really dealing with barriers of people getting in and receiving appropriate services. So very direct connection to improving a lot of what we're talking about with infant mortality here.
Good afternoon. My name is Kimberly Reeves. I'm the Executive Director of the Community Outreach Division for Beacon Health System. My connection to infant mortality is twofold. One, from a professional perspective, I am responsible for the needs assessment that is done across our region, as well as we host the fetal infant mortality review, in particular for St. Joseph County, but we're engaged here in Elkhart County with representation. And I also appreciate the ability to build capacity and assist other organizations that are going to help us improve the infant mortality rate and supports for families. We know that in community we should not and cannot do this work alone, and it takes all of us to be able to create that deeper impact. On a personal level, as a healthcare professional, I experienced a premature birth, and arriving at a healthcare system, I was accused of being on drugs when I asked about pain, and it just struck me as unfortunate. I thought, I am here, I'm educated, I work in the healthcare system, and this is a way that someone can be treated, and I have the privilege in my role to do something to address that on the inside, as well as to help build community. So very fortunate to be in the role that I have.
Hello, I'm Kim Boynton, and I am the Coalition Director for the Building Strong Brains initiative here in Elkhart County That is the early childhood collective impact effort across our community. And one of the pillars that we're working towards is improved maternal and child health outcomes. And what led me to this work is my background is speech language pathology, and for many years I walked alongside families who wanted the best for their children, and I wanted to empower them to raise their child in the way that was best aligned with their goals and their values. And what I found was there were barriers in their way. There were barriers to healthcare access, there were barriers to childcare, and there was unemployment, and there was food insecurity. And it really led me to wanting to work on collective impact with amazing partners and parents in the community that can help us drive real systematic change and sustainable change. We know programs bring us great outcomes, but how do we change at a systems level and build in mental models that this is just what we do here in Elkhart County?
I'm Jim Ballard. I'm the Behavioral Health Response Coordinator for the City of Goshen. I'm part of our new mobile integrated health team. We've added a paramedic to our team. We're looking for a licensed clinical social worker. So I know they're hard to find right now. But with that being said, I'm part of the Elkhart County FEMUR team. If some of our team members could stand up, please. I know that you're out there. They're doing amazing work. It's hard work, extremely hard work. Reviewing those cases, that's part of why I'm on that team as a retired police officer. I've responded to way too many infant deaths, and anything we can do to reduce that's a win.
I'm Brandie Yoder. I'm the CEO at RETA. RETA is a pregnancy and family resource center, and so we offer medical services for those in our community, and we partner with all the organizations to make sure that they have healthy deliveries. We also offer mentorship and then mental health services, so very holistic. And for me, getting into this work, I'm a nurse. I spent many years at the bedside, and I was pretty downstream. I did hospice care, I did ICU, and so having the opportunity to go upstream and work with moms to start that baby off in a healthy manner, hopefully if there's trauma and things, breaking those generational traumatic events from starting and just setting them up for success is something that I'm really passionate about.
Great, thanks everybody. So today we did hear a lot of data, information, some old, but some of it new. I would love to hear from you guys, and I will start. Did you have any surprising aha moments as you were listening to the discussion today? For me, I took a picture of it and texted it to my communications director. A huge part of what we do in public health and also healthcare is communication, and we're always thinking, how can we better communicate? And so I sent her the picture and I said, look, we need to keep on sending messages on Facebook. People are listening. This is where they're getting their information. A new national study just came out showing that people are getting the vast majority of their health information through social media. And right now, it is a lot of spread of some misinformation. And I think that those in the healthcare and public health sector, that we also need to come into this space to help counteract that. So I'd love to hear from you guys, or anybody who wants to jump in. Doesn't have to be all of you, but some of you. Any big aha moments, like maybe you knew it, but it was a different way of presenting it.
So on the social media side of it, what we've started to do in Goshen is we always did everything in English. Now we do it in English and Spanish to get the information out. The other thing we have done is we have a new software system. It's called Gelada. The acronym stands for Just Love on Them Always. And what that system allows is our police officers and public safety officers in Goshen can do a referral straight from a phone, from their computers in their squad car, to our MIH team, which then follows up.
Awesome. Anybody else? So my second question is for all of you guys. So again, based on the information, based on the work that you're doing, what are you most excited about? Either working on something you are working on or have already implemented as just shared in the space to improve infant mortality?
Is it on? I'll start. I think that what I'm most excited about is the continuing growth of the momentum of the collective work here in Elkhart County. We have partners that are willing to come to the table and are committed to drive change. Doesn't mean we always have the answer in the moment, but the willingness to have those conversations, work through barriers that are going to continue to rise to the surface. And so I think the willingness, the commitment, the resilience, and the perseverance to drive this change forward is exciting and hopeful.
Okay. One of the things that we are working on that we found, and to the point that you asked earlier, like what's surprising, I think validating for us is that we're on the right track. And we're listening, and so I appreciate the deep dive today. We are going to be launching a mobile medical unit specifically geared towards perinatal care support, both prenatal, postpartum, and well child visits. And we also want to do this in collaboration with community partners, both clinical and non-clinical, and we're gonna launch here in Elkhart County first. And so we are hopeful that our target date of September comes through, but we're still designing it currently, and it may be pushed off until the fourth quarter of this year, but excited to be able to support the community in that way. And more excited that we're gonna be able to be here in Elkhart County doing this great work.
So one of the themes that I heard today was for individuals in our community, they need to find trusted people who can carry messages that's very relationship based. And I think one of the things we launched through Building Strong Brains a couple months ago was a community resource navigator cohort. And the intention behind that is to listen from those who are working with our families and for them to come together and feel like they have support, that they can learn from each other, that we can do education on what does it mean to provide culturally safe care and being trauma informed, and do you know what motivational interviewing and all those things that were talked about today. So there's some real synergy that's starting in that group and some data collection so that we can really tell the story much like you guys have done today. So I'm excited about that.
So for us at the health department, I mean, we're involved in a lot of these things that has been mentioned, but what I'm so excited about is the fact that we can start to see the change happening. When I first started in maternal child health, our rates were deplorable. We had 2 zip codes in the top 10. It was very discouraging, to say the least. So to see that sort of change and the fact that we're no longer have zip codes in the top 10, I mean, that speaks volumes to me. But we have a great staff that continue to work every day, just going to town, and I love the fact that they love working with these moms. And Marty, before she retired, was starting to see 3rd-generation families. So knowing that, they trust Marty, so there's the trust piece. But we also strive to make sure that we are representing the community in a meaningful way. So hiring people that look like them and can speak like them. So we're excited about all the momentum going.
And I'm interested in seeing how the synergisms across our various organizations actually multiply and become bigger and more effective than what we're doing individually. And so the Community Foundation is doing a fabulous job as a convener and organizer, really kind of pushing the region, the area to do something different. And then the health department and others help facilitate making that happen. And just from a Goshen perspective, we've always had a deep relationship with Maple City Healthcare Center, and what this opportunity allows us to do is get creative of, so how do we do this differently? How do we create more access? How do we share resources? How do we pass patients back and forth? And just the early stages of this new funding program that the Community Foundation has organized, we've been able to identify 11 patients initially that will benefit from this, and getting people in earlier into prenatal care is the game. And so working with Maple City, working with the foundation and the health department, I'm really excited about how this will be better than what we could do on our own.
Okay, so now I'm going to ask the pie in the sky question. If you had unlimited resources, what solution would you pursue to increase access, specifically, to perinatal health among Hispanics in Elkhart County?
Wow. So I felt like we had all the resources in the world, not your fault. But so what I would do is help bring more physicians here. I think Elkhart County isn't always attractive to some people, so I'm just being honest. So people, like physicians, don't come here necessarily. So making it more enticing to be here, I think, would be an excellent start. And having programs such as the one Liliana presented, and other programs available to help facilitate getting into OBs and walking alongside them to be a support, because our system is very confusing. It's confusing for us who live here, let alone those that aren't from here. So.
Oh, I have to answer this. So think about the barriers that individuals deal with, and then the pie in the sky issues address those. So free, multiple locations where people live, transportation when they need it, people who can connect to services and explain things and help people understand why to do this, when you should do this, how do you get connected, and so those navigators, those social workers, and so just bringing more resources, locations, easy access to the table.
Yeah, I'll tag on that, because I would hire a whole bunch of community resource navigators that had the ability to easily access multiple organizations and had really small caseloads so that we had time to effectively do our work.
And I agree with you, because as a public safety officer, that warm handoff is important. And if we have those community navigators, someone that I can immediately connect them to out in the field, that would be a win-win for us.
I'd love to also add to their pies in the sky and say that in addition to what they've said, it'd be great if we could evaluate the systems. If we could look at the healthcare system and the policy and look at, I think we try to do really good work. We try to do our best when we think about the systems and how the healthcare systems operate. But then there are also things that we want to do, but we can't because there are implications or so many rules that our physicians or our midwives have to follow. And what if we just sat down and reevaluated how we can create an ecosystem where they're all working for the good? And I think that would be fantastic.
So I'll just add one additional piece, is that as we're dreaming pie in the sky, keeping things cohesive and making sure, to Kimberly's point, we understand the system and how it's working together, because if we're more cohesive in our work, we'll be able to accomplish more.
So I know I've met at least two young professionals who are learning or about to go into their careers. And we have lots of members from the community here who with little babies who maybe have a future in health and healthcare as well. So I would love to get your advice as healthcare leaders. what would you give to advice to these people who are coming into their careers or going into the careers about the future of healthcare, and what should they be thinking about? How might it look different in the future? Ooh.
I guess it's me. So from my perspective, being in public health, I think there are many avenues into healthcare that we don't always think about. So I actually have an MBA. Once I started working at the health department, I got my MPH. So because it's so interesting. There are so many routes to doing that. Liliana, you have a background in engineering. So, I mean, there's a million ways. And don't be discouraged. Just keep plugging along and you will get there. It took me forever.
I think artificial intelligence will be an interesting evolution for how care is delivered and how patients receive care. I can see a time when things are triggered and people are notified or encouraged to do something based on where they're at in their pregnancy cycle or whatever disease that they're working through. And so these reminders, this information flow, things that happen much more automatic rather than the patient needs to think of it and reach out and go find it on their own. It comes to them. It's more of a push mechanism.
I think too, as technology moves forward, we need to make sure that we ensure that people are able to navigate that. Because if they're not able to use AI or use telehealth, et cetera, that's going to be a barrier.
I would say be a student of the clients that you serve. Don't ever stop listening. I entered healthcare, and I heard the analogy the other day that I used with my kids because they play sports, and it made sense that some people are born on third base and others are born in the dugout. And I was one of those who I feel like I was born on third base. And so the lens that I wear is very different than a lot of the clients we serve. And until I have the ability to be quiet and listen, our systems aren't going to work. So that would be my advice.
Well, and I'll add to what Brandie said, really the listening piece and the never stop learning piece. Systems change, environments change, understanding and listening is really important, and you don't always personally have to have the answer. Asking the question and then sitting with it and then being flexible and adaptable with innovatively thinking about what those solutions might be is really important to this work.
Okay. So I think let's wrap up here today by, I think days like this are incredible, but often people leave and make no change, right? So you get this great information, and maybe you're excited about it, but then you go back and it's work, right? I would like for us all to commit to one action item, right? One action item. What are you going to take and go back to your work, go back to your home, go back to your community, to your friends, and do? So I would like you guys to start. And all 6 of you are going to have to answer. What is your one action item that from today in this conversation that you will go and do?
I would like to take the information from today, which I'm really grateful to have that deep dive, and reevaluate where our current state is and what we can do differently to make sure that we are meeting the community, the Hispanic Latino community, where they are. In addition to continuing to provide supports to our staff so that they have the tools, the resources, and the knowledge to be successful in the way that the community needs them to be. And I'm a fan of a rising tide raises all ships, and I feel like we've done that today, and I think that we can use this is a foundational piece and continue to do, again, the work that we're wanting to do, specifically addressing infant mortality and creating a greater impact.
Well, and I'll add on to that. Again, thank you for the work that's been done here today and the information that is shared. I think there was information that affirmed that we're on the right track. And I also think, to Kimberly's point, really looking at that and seeing where there might be some opportunity gaps that we can think about differently or have conversations about. So I think that will really help us, this information will help us do that.
I'd like to commit our mobile integrated health team to work with our community stakeholders. First and foremost, I will give you my number and my email. We can get it to you from Liliana, or you can see me after this, and I will give you that, and we'll make the connection. With that, we can enter you into our Gelada system as a stakeholder, and it's HIPAA compliant, where we can share information and do referrals.
Well, one of my tangible things that is already on my list, I had a conversation with somebody as we were walking out to the bus about the Community Resource Navigator cohort, and I owe him an email with information. So if you're interested in joining, I can give you that as well.
Okay. So for us, it's always looking at the data continually. That's what we do at the health department, and looking at how we can modify our programs to better meet the needs of the community, and continually adjusting where we can and improving our services to those who need them.
We will continue to work at streamlining the process that we've just begun. And so how do we make it seamless? How do we make it easy? How do we make it fast and efficient? And we're on the front end of that, and our leaders are here to make that happen.
Awesome. And so I will end by giving my commitment as well. I never asked my team to do something I wouldn't do myself. We are in the middle of doing our state health assessment, and from that will come our plan for the state. One of the big components of that is infant mortality, and I think today was a good reminder that we need to not just look at the quantitative data, but the powerfulness of the qualitative data, the voices of Hoosiers across the state, the experiences that they're having. And so that's the note that I took. I need to make sure that our team is getting this information, because we have many organizations across the state that collect good qualitative data, and making sure that that is being incorporated into both our assessment and into our plan. And I would also say that I have known Liliana for my entire time that I've been in public health, and I'm always incredibly impressed by her coalition building. And unfortunately, that does lack in many communities, but it makes all of the difference. In fact, I would say if you went back and where you guys started to have improvement in your infant mortality numbers, I think that is probably, you would see, is where you really started to build coalition and communication amongst one another. So thank you for what you do. Thank you all for what you do and for answering the questions. And I want a show of hands. Everybody have an action item? Everybody, I'm looking at you. Where are the babies? Yes, yes, good job. Okay, all right, thanks everybody. Sorry, panelists. Questions from the public. You must come back up here. And we have questions. Good. Sorry, I missed that instruction. That's my fault. Go ahead.
Let you guys get settled here. My name is Gretchen Souter. I'm a nurse practitioner over at Maple City, but I also am the program director for nurse practitioners, so you know I have to ask this question. Women's and children outcomes are near and dear to my heart because before coming into these roles, I was a labor and delivery nurse. And I see the value of coordinated care. And physicians are definitely part of that care, but so are advanced practice providers. And in states where advanced practice providers have less negative regulation from doing what they are trained to do, not be a physician, but be a nurse practitioner, we see better outcomes. Are there ways that you can see that you could support that movement in our state so that we could help improve these outcomes?
From a local perspective, the mobile medical unit that I mentioned, it's going to be housed by a family nurse practitioner. And so I think we can start by being an example. And hopefully this is something that will continue for a long time to come, and maybe being that model will then expand to other areas in the state. And we do continue to have conversations with our State Department of Health, and I'd love to be able to continue that conversation, but certainly it does take an effort, and I'm happy to contribute to that. The other thing that I'll mention too, you mentioned care coordination. I think one of the things that was an aha for Beacon was we have phenomenal community health workers and doulas, and they're all trying to do the great work, health navigators, and they're out there in the community meeting with the patients. They may be a Beacon patient, but our providers did not have access to that information. We weren't connected into our Cerner system, our electronic health record system, where our providers could actually see the work we're doing to coordinate care in the way that we were wanting to. And I think because of that, we were able to make that a strategic priority for the healthcare system, and now they're finally able to see that. But more importantly, what I'm hoping to do is to be able to bring community into that too. And so that's a continued strategy that we're working on, completing this year and then continuing it for 2026. It was just approved by our hospital leadership, and it gets approved by our boards in October. So I'm hoping, again, that we can leverage other resources, other family nurse practitioners or advanced practitioners in the community to be able to contribute to that level of data to help strengthen the case.
I will just add, we do have a new health workforce council that the Department of Health is helping to support. They have decided on focusing on 3 areas. One is a space of OB, specifically delivery services, but also prenatal care access in communities. We have continued to see hospitals stop delivering babies. And we're aware of a couple more that may stop delivering babies here in the next couple of years. And so just paying attention to that. What is our plan for the state of Indiana? When the hospital stops delivering babies, the OB, that means, are often leaving, which then means it affects not only prenatal care, but also women's care in general. One of the things through this process that we recognize that we don't have any programs in Indiana for certified nurse midwives. No one has corrected me on that. So I think that is truly the case. And that means that that they're going out of state. And we know when people go out of state for training, they're often not coming back. So one area we're looking at, another thing we identified is that we only have one family medicine OB fellowship, so where family medicine doctors can do an additional year to be able to learn to do more C-sections, and they have more deliveries. And again, this is part of like the full spectrum of care. It's going to take all of us to be able to provide these resources. The one that we have is in St. Joe. We also know the majority of those fellowship trained residents go out of state after they finish their training. So where can we have another fellowship opportunity? How are we giving access to OB residents to get trained in rural communities? We've heard from our OB residents. I've spoken to them directly in downtown Indianapolis. There's 40 of them sitting in front of me. They are afraid to go work in rural communities because they don't know what it looks like. They are trained in these state-of-the-art, every specialist, every tool and thing and tech that you could ever have, and they don't know what it looks like. And so just giving them the opportunity to see, look, it's okay. What an amazing thing to be able to live your neighbor's baby and the mayor's baby, and and so we have that now. We're working directly with a rural hospital who's going to now start taking residents to do a rotation there so that they can get that experience. So we are trying to do what we can, which is in the sphere of what the Department of Health, and I want to be really clear about that. There are spaces that we can kind of engage with, and there's other spaces we would have to look to people in the community for you all to go advocate to your legislators and others for. So we're doing what we can, but we're always willing to take some more input. Any other questions? Yes.
Hi, oh my gosh. I'm Sheng. So aside from announcing the raffle winners, I also run a data and AI solutions company for businesses and organizations. And I was just wondering, because Randal, you talked about AI a little bit just now, and I was just wondering, do you guys see how AI would impact your organization and the work that you do in the near future? And whether that brings more benefits or more kind of like downside, and if there's more bad effects, I suppose, what kind of precautions do you guys take or would take to combat that? Thank you.
Yeah, so this is an exploding area in our organization and kind of nationally in the healthcare arena. We seem to have AI scattered all over the organization. Many, we've got 7 different robots in our organization now that has a lot of functions with AI. We use ambient listening tools. We use dictation tools. We have clinical information summarization, I'll call them pop-ups, things that present information. This is only going to continue to explode, and the challenge is exploding. And so which ones do you select? How do you vet through all these? These aren't companies that have been doing this for 20 years. It's a bunch of startups. And so which ones are going to survive? Which one has clean data? So much of AI is based on its cumulative learning. Well, is its learning biased towards nationalities or specific geographies that may not be appropriate or applicable to your areas? And so those are all concerns as part of the data management governance process of who do you pick, how do you vet through all the companies, how do you know there's good data and it's producing good information? I mean, we all are, I'll speak for myself, I have on my phone this AI button that I ask questions to it every now and then, and I get this great answer, and then I go, so is that right? Sounds good. Well, that's now what we're dealing with, is great information, unsure of the source and the accuracy.
Similar with our health system as well. In terms of community or population health, I do see an opportunity to potentially start looking at wearables and smart technology and AI capabilities within that to see how we can create more efficiency and effectiveness and maybe more personalized care when it comes to providing patient encounters with individuals. That's something that we're exploring now, and I anticipate that is going to only increase.
I think there's going to be a lot of exciting opportunities in the future, right? We're only as good, our data and our research is only as ever good as we ask questions. I think the exciting thing about AI is that may start to be able to ask questions that we haven't thought about. Specifically for me in emergency medicine, just after my 15 years of experience, you start to recognize patterns in labs and certain things that people say, and now I know what the next question should be from me. And I do think that, and it's my job to try to teach the residents, but it takes 15 years of experience to get there. How do we shorten that time period? How do we take that collective knowledge of that time and experience people get to be able to kind of reduce that time frame? And I think that's a place where AI is going to be able to help, right? I always think about this patient I had who I was working with through an interpreter, and she came in for vomiting. And I could tell that me and the interpreter, which was on a machine, right? And the patient were struggling, that there was something there. But then I noticed when she said vomiting, she kept on pointing to her throat. And then I asked the right question. She wasn't vomiting, she couldn't swallow. Food was getting stuck in her throat and it would come up again. She had a terrible infection. Had I not asked that right question, that woman may have died within hours because her airway was getting closed. So it just always reminds me, and I teach that to my residents, but how are we taking those little lessons and just incorporating that into, I think someone brought up, a checklist, or the system scanning these labs for those little small changes and abnormalities to put together a fuller picture. So I think there's a lot of potential, but there's going to be a lot of risk too. Yes, ma'am.
I'm sorry. Yeah, thank you. So you mentioned earlier at the loss of midwives and providers and hospitals closing down. What can be done at a systems level to increase interest in those healthcare positions, but then also make there be less of a barrier between those who want to be in those positions and actually reaching that, as far as education, scholarships, grants, or something that puts people back in those offices?
Yes. I have thoughts. You guys want me to give thoughts, or anybody else have any thoughts? Okay. So lots of things. So if you look at Indiana compared to our surrounding states, just in the physician space, we are training way more residents per capita than our surrounding states. So already they have an advantage, because let me tell you something. In the state of Indiana, if that kiddo was born here and did their training here, they did their medical school and residency here, 78% of them are staying in Indiana. So we are really good at keeping our professionals when we train them here, right? But if we already, as soon as our kids graduate from medical school in Indiana, whether they're at Marion or IU, we already from out of the gate we have 50 less spots in residencies than those graduates. So we have to immediately push away 50 of them. And they live and they stay and they raise their families where they go to finish their training. So that's like one kind of low-hanging fruit. How do we increase the number of specialties? Also, the states surrounding us, for example, Michigan offers up to $300,000 in loan repayment to OBs. Can't compete with that, right? So that's an opportunity. We're not even close to the other states around us and how much we're doing in loan repayment programs. Specifically looking to push them into rural communities. What are those incentives for people coming out of training? And I'm just talking about physicians, because that's where we started, and we're going to move into our advanced practice providers, nurses, CNAs, QMAs, all the spectrum, right? But we have to start looking at the data and asking the right question. Those are just a couple of the things that we identified. I already talked about the OB fellowship as well. I think the other thing is too, where we're really successful, and someone actually mentioned this to me earlier, if you identify that kiddo in grade school and high school who is interested in healthcare, and you support them at every step of the way, they are way more likely to go back and work in that community, right? Especially if you kind of incentivize them to do that. So it is up to all of us to make sure that we are talking to this next generation about health, public health, right? Yes? Healthcare, community-based organizations, licensed clinical social workers, that they're getting the full spectrum, right? It's not just doctors and nurses. There's all these people that it takes to make this big system. And so how are we working with our high schools, with our Ivy Techs, with our other places to make sure people are learning about all of these opportunities in their community, and that they know where those opportunities are in their community? Really quickly, for an example, EMS. We know a lot of people who are interested in paramedicine. They don't have access to a good training program in their community. And so in order to get that training, some of them are having to drive like an hour to go get that facilitation. So then they're just not going to do it, right? And so our rural communities are really struggling with having paramedics available to go. If you call 911, you expect someone to show up. But there's lots of places in our state where you're waiting 45 minutes or an hour. So there's lots of good stuff, but we have a lot of opportunity too. Nobody has anything? Oh, okay. Any other questions? It was perfect. Okay, thanks. Are we good? Okay, let's do it. Thank you, guys.